I'm Dr. Sam Marzook, a child psychologist in Minneapolis, Minnesota, with a passion for helping kids and teens who have type 1 diabetes. If you're an adult and watching this video, you and I have something in common. We've both had the pleasure and displeasure of having once been a teenager. We know what an exciting yet stressful time adolescence can be. From the quest to understand who we are as a person, the never-ending desire for our parents just to leave us alone, to the actual biological changes that we had to endure, we remember how tough it could be to be a teenager. Now go ahead and throw into the pot a chronic medical condition like type 1 diabetes, and now we got a whole new set of challenges. So in this video, I'm going to highlight 3 keys that parents of teenagers with type 1 diabetes should understand. First things first, honor their need for independence. When children grow into teens, their need for independence and autonomy grows as well. Most teens with T1D desire more control over the management of diabetes. Now, as parents, we still very much need to be involved with diabetes. We know this, but we also should honor their need for independence. So I suggest sitting down with your teen and listing out all the responsibilities that come with managing diabetes, from counting carbs, checking blood glucose values, to ordering supplies and scheduling endo appointments. Then with your teen, go through each of those responsibilities and decide collaboratively who's responsible for what. This helps to show your teen that you're respecting their independence while also getting crystal clear on who's responsible for what the teen is expected to do on their own, and how the parent is going to help. Number 2, be that boss. I sometimes ask parents of teens who have diabetes to reflect on their favorite boss. If we think about our favorite boss, we can draw several lessons relevant to diabetes. First, I'm willing to bet that your favorite boss didn't just tell you when you were screwing up, but also told you when you were doing good work. So be sure to point out what your teen is doing well when it comes to managing diabetes. Second, this boss probably made very clear what they expected of you, so I recommend making sure you make it clear what you expect of your teen when it comes to diabetes management. Finally, I'm also willing to bet that this boss didn't just talk about work and actually showed a genuine interest in other areas of your life. In other words, they treated you like a human being instead of just an employee. So make sure you're not just talking about diabetes with your teen. Teens hate this, and they will shut down if they think all you want to talk about is diabetes. And last but not least, focus on the journey, not just the outcome. As parents, it can be so easy to get caught up on A1Cs or blood glucose levels with your teen. And while these numbers are certainly important, I suggest focusing more on what healthy behaviors your teen actually has control over. From taking insulin at the right time, counting carbs, to checking blood glucose values, all of these are behaviors that your teen can control. And when we shift our focus to these behaviors rather than outcomes, we give our teen a greater sense of control over managing diabetes. Now look, these aren't the only things to be aware of, but I want to invite you to consider that these 3 keys are the foundation for a healthy partnership between you and your adolescent when it comes to managing T1D.